eCancer Television now has the opportunity to welcome both Reinhard Stauder from Innsbruck and also Mario Boccadoro from Italy. What are you involved with at the moment? You've just come out of this session, a roundtable discussion aimed at looking at managing elderly hematologic oncology patients. What were the key things that came out of it? First of all, if I may ask you, Reinhard, about evaluation, because that's a big issue, isn't it?
It's an important issue because we have to realize that the majority of our hematological oncology patients are older than 70 years. So in many diseases, median age is around 70 or even 75 years. So we have to evaluate the physiological age. Physiological age should form the basis of our decision. So it should not be the passport age, it should be the individualized treatment, which is the most important thing in decision making.
And you had contributors at the session talking about all the different malignancies, myeloma, MDS, CLL, lymphomas, AML. Is it the same for all of these?
We realized one of the conclusions was that it is quite important to include this evaluation of physiological age in all different blood cancers. So, and we have discussed which is the best approach, which is the best way to establish it, the best way to integrate it. But without any doubt, it has to be integrated in all hematological malignancies in the elderly.
Now, how does that ring with you, Professor Boccadoro? Because you are also interested in the whole process of decision-making about therapy for the various hematologic malignancies. First of all, you've got the evaluation and the fact that physiological age is now considered to be paramount. What's your thought then in terms of decision-making?
Before making a decision, you have to look at the several possibilities that we have in several hematological malignancies. We are going from allogeneic transplantation to the new drugs to the palliation. I mean, the array of possibility are enormous. So we have to take in account the biological characteristics of the disease. We have to decide which is the best treatment. But first of all, we have to talk with the geriatrician, and we have to establish a collaboration between the geriatrician and the hematology. And this is the only possibility to make the right therapeutic decision to your patient, because you have to take in account the response rate, but also the toxicity of every drug in every patient.
So one of the special things in elderly patients is that the geriatrician can have quite a big input.
There are at least 3 new drugs that has been explored in randomized trial that are giving excellent results that we never saw before. But that is not true, doesn't all true for the elderly myeloma patient, where you have a rate of discontinuation of about 40%. So it's right, it's obvious that the dose is not the right one, that we have to take in account several other aspects. We have to modify, and we need specific trial for these patients.
So how does that ring with you?
That sounds quite well. I mean, it became clear to us. I mean, we made interactive questions with the audience, and the majority of hematologists in Europe believe, or they are fully convinced, that this cooperation between hematologists and geriatricians has to be improved. So this is one of the major points at this conference.
I know that there was this whole thing at the beginning of the conference about what is classified, what's the definition of old age. Do you think that is evolving as the conference progresses?
Yes, I have the feeling that it is evolving because the specialists from the different entities, they start to realize that the median age in CLL, in myeloma, in myelodysplastic syndromes is much higher than they had anticipated before. And an important point was that physiologic age is more important than chronological age.
And from what you're both saying, the cooperation and teamwork and the multidisciplinary aspect of care seems again to be extremely vital, especially in older patients, would you say, either of you?
At the end of the session, we had some criticism from the major experts saying that we need more support for this. If aging, it's really the major problem in the European community, we need support because, you know, to establish this multidisciplinary team is more complex than before. So the criticism was that the European agencies are recognizing this problem, but probably not yet supporting adequately these new activities. Are new activities, you know. It's more complex than before.
And there seems to be also a growing awareness that this is a speciality that needs to be named as a speciality, geriatric oncology. What do you both think about that? I mean, the conference here is very vigorously supported. It's a full house.
But there are some areas that need more support. Are the area where you have the advantages in the therapy for myeloma. For instance, there are some diseases where the survival is unchanged in the last 20 years, but where you have big advantages, so you have to establish there the cooperative teams.
I feel that there are two major points which are responsible that colleagues are interested in elderly cancer patients. Point one is that elderly in real life form the majority of our patients, so they are just there, so which means when they go back on Monday to their hospital, these elderly persons will be there waiting for a decision. And secondly, colleagues know that decision making in elderly is not as easy than in younger. It's complex. You have to consider comorbidities, you have to consider cardiac impairment, and so on. And that's why they are glad to have a conference where these points are addressed by the specialists.
So could I ask you both finally, what are the practical messages that will help doctors to make these right decisions and do the right evaluation? Mario first.
My last slide, there was a big sentence. We need tools. We have to elaborate new tools and to validate new tools. So all the doctors, they can rapidly assess the patient and in the multidisciplinary fashion. So I mean, we have to go in this direction to elaborate to create new tools.
Reinhard, do you think that doctors are equal to this at the moment? Will they be dismayed by the difficulty of treating older patients with blood cancer, or are there definite things that you would recommend doctors to be doing right now?
Yeah, I mean, I would recommend to include a multidimensional assessment in their evaluation process. And one more important point is to develop recommendations and guidelines, particularly for elderly, so then the colleagues have got a kind of help in their decision making.
There is a journal of geriatric oncology now. It's a new publication. What's the importance and the relevance of that publication in this era where we are now very aware that older patients need a particular category of treatment?
So the Journal of Geriatric Oncology is new. It was launched in 2010. It is the official organ of the International Society of Geriatric Oncology, and it addresses all questions and items related to elderly cancer patients.
Well, that sounds very wise counsel. Thank you both very much, Reinhard and Mario, for joining me on eCancer Television.